I have a crazy, crazy clip for you. This relates to the entire culture of people will be lazy from the right. This is a common thread from the right. It's arguably, this particular clip, one of the most disconnected, desperate attempts from Fox News to make basic welfare and social good programs look bad because they'll just make everybody lazy. And the right has been pushing this narrative for a really long time. It arguably dates all the way back to Ronald Reagan's totally bogus story about, I believe it was the Cadillac driving welfare queen. But the common examples are if you give people unemployment benefits, you are incentivizing not working so people will not work. If people get a basic income, then nobody will work. If you disconnect health insurance from employment, people won't want to work since they won't need to work in order to keep their health insurance anymore. If you give people food stamps, they won't work because they'll be upset or whatever, right? So these are pretty transparently bogus arguments, which gets us to Fox News' Jon Scott just a couple of days ago. Now, if you're not familiar with Fox News' Jon Scott, he's one of the most boneheaded and really one of the most obviously clueless on policy Fox News talking heads. He came up with something that is brilliant in its insanity. This was a discussion that they had about Donald Trump cutting some of these Obamacare subsidies for low-income people. And I told you the details of that earlier this week. And in that conversation, Jon Scott suggested, if everybody just gets free care, why would anyone even try to stay healthy? These are 17 seconds of unbelievable, total, utter garbage. And I'm presenting them to you here. Take a look at this.
What's the motivation? If these are the poorest Americans who are getting their co-pays and things like that covered, what's the motivation for them to try to live a healthier lifestyle? I mean, if it doesn't cost them anything to go to the doctor, what's the motivation?
If healthcare is covered, what would motivate people to be healthy? Oh, I don't know, maybe the human desire to remain alive. Can you imagine this level of disconnected, depraved thinking? We talk about nature versus nurture. What characteristics are learned versus what characteristics are instinctual or ingrained. And there's lots of debate about many of those, but there's one that is not controversial, which is the human instinct to survive. And Jon Scott is framing this as if if people know that no matter what they do, whether they live a sedentary lifestyle or remain active, whether they eat unhealthily or they eat healthily, no matter what, they are going to not have to pay co-payments. So people are all of a sudden going to have no incentive whatsoever to live a healthy life. Can you imagine? Oh, I no longer have to pay $25 to go and be seen by my doctor. Well, I'm going to start binging on the most addictive drugs, never exercising, and eating myself to morbid obesity because I no longer have an incentive to be healthy. It implies that the only incentive to remain healthy is to avoid the costs associated with obtaining health care. This is out of this world, total rock bottom Fox News insanity, but I wouldn't be just playing these 17 seconds of video if the only reason were to make fun of Jon Scott, and that's a really good reason, but it's not the only reason that I'm doing this. There's this reminder in the background of an incorrect talking point around so-called free healthcare, which of course I call it so-called. It's not really free, right? I mean, you pay for it through taxes. That's not really something that is hidden by advocates of single-payer healthcare or Medicare for all. There's this idea that as soon as people don't have to pay for co-payments or premiums for health insurance, they will start overusing health insurance like it's some kind of entertainment, right? It's a total and utter myth. The idea that as soon as you have no copays, you're going to start looking for unnecessary medical procedures as soon as you can because you don't have to pay for them is absolutely ridiculous. It's not borne out by any research that has been done. And the truth is, if all of a sudden people didn't have to pay copayments for health insurance, they'd probably get care earlier at the first signs of some conditions, which is significantly cheaper for the system than letting conditions worsen and then needing treatment of an acute problem. People now tend to want to avoid their $25 or $50 copay or more, depending on what insurance you have, until a condition is serious, because the rationale is, hey, if I've got to pay a copay and I'm probably okay, if this is probably just a virus that will go away on its own, that is a disincentive to get treatment earlier. So this Jon Scott clip is completely and totally whacked out, but it actually does relate to a common talking point about single payer or Medicare for all that is important to debunk. And meanwhile, I guess we also have to tell Jon Scott that there is this thing called the human desire to live that most animals actually share with us, which sort of creates an incentive to not eat yourself into total morbid obesity or to start binging on the most destructive of addictive drugs.